This virus can start multiplying in your hand and go up through your nerves, wanting to eat your brain and take control. What does it control in my body, you might ask? Your throat, your diaphragm, your motor nerves, and even your mood. Why and how does that virus make all this effect? Let's start by getting to know some features of this killer. The rabies is a bullet-shaped, enveloped, negative sense, and single-stranded RNA virus belonging to a Rhabdoviridae family. Its transmission depends mainly on the saliva of an infected animal through a bite or scratch. Worldwide, dogs are the most common source. In developed nations like the US, wildlife like bats, raccoons, and foxes are the primary reservoirs, with bats being right at the top. By any means you get a bite from a dog or a bat, the virus replicates locally in muscle tissue and binds to nicotinic acetylcholine receptors at the neuromuscular junction. It then travels via retrograde axonal transport along your peripheral nerves to the dorsal root ganglia and the spinal cord until the virus reaches the brain, causing widespread encephalitis and neuronal degeneration. Finally, the virus moves outward along cranial and peripheral nerves to other organs, including the salivary glands, which enables transmission, the cornea, and the skin. The bad thing about that virus is that once symptoms appear, death is almost certain for these patients. Okay, but what happened before the symptoms? Well, you would think that the virus needs time to travel from your hand to your head, right? You're right. It usually takes 1 to 3 months, but it can vary from days to years. It depends on the virus dose and the distance of the bite site from the central nervous system. For example, a bite on the face has a much shorter incubation period than a bite on the foot, so symptoms will appear faster. There are some mild symptoms that may appear after getting the bite during what's called prodromal phase. These are non-specific flu-like symptoms like fever, malaise, headache. A highly suggestive sign at this stage is pain, paresthesia, and itching at the site of the healing bite. This is the first major sign that the bite carried the virus. Okay, so I said when symptoms appear, a high chance of death will happen. But what are those symptoms? After the virus travels and reaches the brain, we enter a phase called furious encephalitic rabies, which hit 80% of the patients. This phase will make the patient hyperactive and cause agitation, autonomic instability, and the classic sign of hydrophobia and aerophobia. This is the fascinating thing. The virus actually controls the pharynx muscle so that you can't drink water. This prevents you from washing the virus down into your stomach to be killed. As a result, the virus remains concentrated in the saliva and can transmit easily. Second phase called paralytic dump rabies, which hit the remaining 20% of the patients. Some people may not develop these hyperactive symptoms, and the virus remains silent. This phase presents as an ascending flaccid paralysis that can easily be mistaken for Guillain-Barré syndrome, eventually leading to respiratory failure. So here, no agitation, no spasm, no salivation, a silent, inevitable death will happen. These two phases may eventually lead to coma and death, which typically occurs within weeks of symptoms onset due to respiratory or cardiovascular collapse. If I got bitten, how do I know if I have rabies or not? Well, it's hard, and even the World Health Organization doesn't have a single standard protocol for diagnosis. But there are tests like RT-PCR of saliva or CSF, viral isolation, and direct fluorescent antibody testing of the knuckle skin biopsy. All of these tests are for a living person, which is called ante-mortem. If the patient dies and we want to confirm it was caused by that virus or not, the pathognomic finding is the presence of Negri bodies. eosinophilic cytoplasmic inclusion bodies found heavily in the Purkinje cells of the cerebellum and the pyramidal cells of the hippocampus. This is where the virus was replicating and take control. After it kills the patient, it leaves behind what are called Negri bodies. You may all be asking, would anything help prevent this? The bad news is that there is no effective treatment once clinical signs appear. But for people who got a bite and suspect it had rabies in it, going for a PEP is a medical emergency for any suspected exposure. Post-exposure prophylaxis include wound care, rabies immunoglobulin, and rabies vaccine. Wound care include immediate and vigorous washing of the wound with soap and water, and a virucidal agent like povidone iodine. Rabies immunoglobulin provides immediate passive immunity. The full dose should be infiltrated directly into and around the wound if anatomically feasible. Rabies vaccine, an inactivated viral vaccine that provides active immunity for previously unvaccinated individual, is given in a 4-dose series on days 0, 3, 7, and 14. Post-exposure prophylaxis is perfect, and the survival rate reaches practically 100% if you get the time factor in your side. Timing is the single most critical factor. Think of it as a race to the brain. PEP is highly effective because of how slowly the rabies virus travels. The virus must make its way from the bite site up the peripheral nerves to the central nervous system via retrograde axonal transport, which only moves at about 8 to 20 millimeters per day. This slow transit time gives PEP a window of opportunity. The rabies immunoglobulin provide immediate passive antibodies to neutralize the virus at the wound site, while the vaccine stimulates the patient's own immune system to build active antibodies. As long as this immune blockade is established before the virus reaches the spinal cord and the brain, the patient survives. Once you get a bite from any animal, especially bats and dogs, wash it immediately and go to hospital for emergency care. And take care, everyone.